Another big bill is in the mail for cities and counties, health care for retired government employees. No one knew exactly how big that bill was until now. CBS5 political editor Hank Plant has the bottom line.
California's bill to fund health care for retired state workers just hit a whopping $51.8 billion. That's a $3.6 billion jump from just last year. It's all part of a new estimate from State Controller John Gioia, and it means that health care now tops pensions as the biggest problem facing the state when it comes to retirees. Chris Hunt of the Contra Costa Taxpayers Association has been sounding the alarm for years.
When I first came to Cocoa Tax, I used to work in healthcare, and I went to everybody in the government here in the county and said, this is going to be so much worse. You guys are all, than the pension. You guys are all worried about the pension. Let me tell you what's going to happen to your healthcare. You've been promising healthcare for decades and never set any money aside. And unfortunately, when a study was done, unfortunately, I was right.
At the state level, California has not been putting enough money aside each year to cover retirees' health care. But the state could take a lesson from Contra Costa County, which has addressed the problem and has essentially cut its retirees' health care debt from $2.8 billion to about half of that.
In Contra Costa, we've started setting aside some money each year to partially pre-fund that obligation for later on when someone retires. Two, we now require that you work at the county for most employee classifications 15 years to be eligible for retiree health care as opposed to coming in right away and getting it.
In addition, for new hires in the county, there is no obligation to provide employee retiree health care, although the retirees can buy into a plan.
When they started offering health care, it was $5 a month. Nobody thought it was, was going to be a problem, so they kept promising this, never thinking that people were going to be living 40 years after they retired, because remember, public employees tend to retire very early, and this obligation sat there quietly being unfunded.
So what works in Contra Costa may work elsewhere.
We did it in a way that worked for us, but I think there is a way out of this if you sit down and try to be cooperative with your employee unions to solve the problem.
Now, one thing that's changed is that local governments now must report their health care obligations. Sometimes the news hurts, but Alan, at least we now know how much money they owe.
All right, Hank Plant, thanks very much.